Welcome. You're watching the Health Talk session by Yashoda Hospitals. Obesity is getting bigger in India. About 1 in every 4 adults is having a weight problem. Obesity is not just a mere cosmetic consideration, but it is one of the major causes for many progressive disorders such as heart attack, stroke, diabetes, chronic kidney disease, and liver disorders. So let's discuss about obesity and various surgical methods and how to tackle obesity in our today's episode. I'm Dr. Lakshmi, and joining us today, we have with us Dr. Kona Lakshmi Kumari, consultant bariatric surgeon from Yashoda Hospitals, Somajiguda. Welcome, ma'am.
Thank you.
So, doctor, according to a recent survey, about 1 in every 4th person in India is having a weight issue, and we also saw young people having sudden cardiac deaths, especially after this pandemic. So, what is the role of obesity in this situation?
Actually, obesity is a silent pandemic. We have seen an acute pandemic in COVID. We saw that with sudden surge in the disease, we saw a lot of people losing their lives, lot of people becoming sick, and lot of people developing long-term sequelae, what we call the lungs going bad, and most of them not able to get back to their full physical activity. So, when we compare this acute pandemic to a chronic pandemic like obesity has been silently surging over the maybe 40-50 years. Earlier the developed countries faced this pandemic, and now it has come to the second level countries like Asia, and also going into the third level countries. Mainly with this obesity, we have seen a lot of increase in what we can call metabolic diseases or lifestyle diseases, which are taking a toll on the general public health. And in this pandemic, when people became more sedentary, we saw a lot of them gaining weight and developing again increased surge in sudden cardiac deaths, mainly in the young population.
So, doctor, you've just mentioned that obesity is a silent pandemic. So, do we really have to consider obesity as a disease? And as a surgeon, how do you manage or treat obesity?
Now, obesity is considered a disease, and WHO has said that obesity is a disease and has to be treated like a disease. And me being a surgeon, we always have to treat the people who are morbidly obese, that is where the obesity has reached that much of level that the person himself or themselves cannot reduce the weight, and we have to use surgical measures to give them weight loss. We do procedures called bariatric or metabolic surgeries, which give the person a certain degree of weight loss, which helps them to resolve their not only the weight they have gained, but also the associated diseases which come with the weight gain.
So, doctor, when do you think a person should approach a surgeon for the bariatric surgery, and are there any changes in the recent guidelines as far as bariatric surgery is concerned?
When a person has tried all ways of losing weight and their body mass index is going above 30, and slowly they are developing metabolic problems, like they are becoming borderline diabetics, or their blood pressure is going up, or their already existing diseases like diabetes or hypertension are going beyond the medical control, or they are developing respiratory problems, or their activity levels are getting limited because of the joint pains, that is when they should take notice and approach a bariatric surgeon, because above 30 BMI, if the person is not able to lose weight by themselves and they leave like that, then there is a high chance that these people's medical problems will aggravate and there is high chance of these cardiac deaths or respiratory deaths happening. And the recent guidelines which has been provided by the ASMBS, which is the American Society for Bariatric and Metabolic Surgery, they made guidelines saying that earlier guidelines said anyone whose BMI is above 40 will should be offered a bariatric surgery, and anyone's body mass index above 35 with metabolic problems should be offered a bariatric surgery. But now they have changed it and they have said that anyone whose BMI is above 30 and having any of the metabolic diseases should be considered for bariatric surgery, and anyone whose body mass index is above 35 and are not able to lose weight by themselves should be considered for bariatric surgery. And specifically they have made one guideline for the Asian population where they said that you should offer bariatric surgery if someone's weight is above 27.5. So, because Asians are more prone for metabolic diseases than their Western counterparts.
So, in general, ma'am, what are the benefits for a person undergoing bariatric surgery?
When we offer bariatric surgery to a person, we are not only looking at weight loss, because weight loss is bound to happen with any of the types of bariatric surgery we do. But apart from that, we see almost 80 to 90% improvement in their diabetic status, means their sugars controls become easy. Most of them may not need a medicine to control their sugars. We have seen people also taking insulin, coming off not needing their insulin to control their diabetes. Their high cholesterol levels normalize, most of the blood pressure medicines reduce, and people with early joint pain subside, and people who are having OSA and needing BiPAP machines don't need the BiPAP machines after a certain degree of weight loss. And for females specifically, those who are fighting the problem of infertility, once they start losing weight, their infertility issues resolve, and even if they are using assisted reproductive methods to help them overcome the infertility problems, the techniques become more successful. Because if a lady is obese and you do any of the assisted reproductive techniques like IVF or ICI or ICU, anything, the techniques usually are not successful. But once the lady loses weight, then there high chance that these techniques will certainly help her to conceive and have a baby. So, and on the whole, most of these obese people have lot of depressive illnesses because of the weight. So, once they lose weight, the depression comes down, they become more socially active and more effective in doing their jobs. So, by doing one single surgery, apart from weight loss, we are giving a total new improvement in their general physical and mental and social condition to the patient.
I think it's really good that how a person undergoing a bariatric surgery can feel afterwards and bring so much positivity to their life, be it physical, mental or social. So ma'am, what are the general risks associated with this surgery? Are there any, if at all?
When we talk of surgery, we always have to consider that we are putting the patient under anesthesia and we are going to make small cuts and do the surgery within them. So, when we are doing a surgery, there is a 1% chance that there can be small bleeds, or the intestines what we are joining may take time to join and there can be small leaks sometimes, or the person, because they are so obese, already have bad heart or bad lung which are bound to trouble us when we are doing the surgery. But all said and done, the standard risk for a bariatric surgery is less than 1%. It is similar to a obese person undergoing any other surgery like a gallbladder surgery or a hernia surgery, even a cardiac surgery or a spinal surgery or a joint replacement would carry a little more risk than a bariatric surgery in that individual. So, I would say it is a very safe procedure, and if some of the people have a bad medical profile, then we stabilize the profile and make sure that all precautions are taken in with a multidisciplinary team and the best results are given to the person.
So doctor, when a person undergoes bariatric surgery, how long does it actually take to see the effects on them?
So once the surgery is done, it easily takes 6 months to a maximum of 1.5 years to see the total effects of the bariatric surgery. But the immediate effects what we see is, by the time the person is leaving the hospital post surgery, we see their sugars being coming under control. Most of them come to the hospital taking lot of medicines to get their sugars under control, but by the time they leave the hospital, their sugars are almost under control, not needing much of medication or no medication at all. Most of their blood pressure also comes under control. So someone is taking 2 or 3 medications for blood pressure may need to go home with a single tablet, and in few months they will themselves tell that we are feeling less breathless and we are not needing to use our BiPAP machines, and our activity levels have improved, and the laziness which was preventing them to be more active in the daytime, and the daytime sleepiness all dissolve. And for ladies who have been suffering from irregular cycles because of PCOS and obesity, start telling that their cycles have regularized, and by the time the person has lost 50 to 60% of their excess body weight, they look more fitter and they are more active, and their blood profile almost normalizes, their cholesterol levels almost become normal. So we see a big metabolic change by the time 6 months is done, and by the time they cross the 1.5 year mark, you see a completely new person with a new quality of life than what compared to what they were having before the surgery.
I think that's really nice. So what are the lifestyle modifications that one has to follow, especially post surgery, ma'am?
We should always remember that this surgery is helped to assist you with your weight loss. So once the weight loss is happening because of the metabolic phenomenon, we have to help our system, that is our body, to achieve the best out of the surgery. So for people who have gained this weight because of eating disorders, should learn to control their eating disorders, and lot of our dietitians will be helping the patient to control their eating cravings and also portion control with regular counseling, but they should also be putting an effort to be controlling the portion, and also their family support is very important, that they don't push the patient to feel guilty that he is not able to eat. So family support is important, and from medically, from the operating team, we as treating surgeons and our nutrition team is continuously helping the individual to get out of the food dependence. And then if sedentary lifestyle was a part of their life before the surgery, we encourage them to start doing mild exercise, then gradually progress to moderate exercise, because now they are feeling less breathless, their joints are less painful. So we should encourage them to start using some form of exercise. Even a simple thing as walking would be of great help for them. We have lot of people who have, once they have achieved a good weight loss, they are doing swimming, they are doing daily 5 to 10 kilometers of running, few are doing half marathons. One of my patient has also completed a full marathon. So it is your mindset which has to change after the surgery.
So that means there is a possibility for a person after undergoing bariatric surgery to put on the weight that he has lost after surgery?
Yes, if someone is very indisciplined and they have no care for themselves and they are continuously eating very high calorie foodstuffs, yes, some of them would surely put on some amount of weight, and rarely there are some people who are very, very indisciplined and who will not listen to any of the advice, and they may gain most of the weight they have lost. But usually now we have made very strict protocols that when we select a patient for or offer a patient the surgery, we first analyze their mindset, and if they are not very sincere about weight loss, or they themselves are not motivated to weight loss, we would not offer them surgery at first go. We would ask them to first try diet and exercise and first get their eating disorder into place before we take them up for surgery.
So doctor, it's now time to bust few myths and know what the facts are. The first one, bariatric surgery is extremely dangerous and rarely done in our country.
No, bariatric surgery is a common surgery. It is like any GI surgeries. Daily in a gastrointestinal surgical department, we keep doing lot of GI surgeries, of which bariatric is one of them, and almost we can say in our unit we do almost 10 to 15 surgeries per month. That is a single unit. So across the country, maybe few thousands of surgeries happen every month. Across the world, the risk is only less than 1%. So I will not tell the people to get scared because it's a surgical process, but utilize the surgical process, because if you don't lose weight, then the weight is certainly going to damage your life.
The next one, post surgery one has to be only on liquid or semi-liquid diet.
Yeah, that is only for the first few, maybe say few weeks of post surgery. When after the surgery we put the person on a liquid diet for 2 weeks, and then they move on to a semi solid diet for another 2 to 3 weeks. It is to get the person habituated to eating into a smaller stomach and a lesser length of intestine. So this is a common practice with most of our gastrointestinal surgeries, where after doing a gastrointestinal surgery, we suddenly don't feed the patient lot amount of food. So that is a standard guidelines which is done even for any of the gastrointestinal surgery, which is followed for this surgery also. And lifetime staying on liquids or semi-solid diet or not able to eat adequately is a wrong myth, and it should not deter you from undergoing the surgery.
The next one, bariatric surgery will affect women's fertility and it will be difficult for them to have children.
Bariatric surgery for true affects the fertility, but in a good way. Lot of obese ladies who are struggling for years to conceive, and also even the best of the assisted fertility centers are not able to give them a result. If those ladies come and lose weight, for sure we have seen lot of people conceiving spontaneously after weight loss and or achieving very good results once they go back to the fertility centers. And it is a scientific fact that obesity causes infertility and weight loss improves fertility. So obesity surgery will improve your fertility instead of damaging your fertility.
And taking the last one, a patient has to be of a particular age to undergo bariatric surgery.
Yeah, usually what is mentioned is that a person has to achieve the adult height before we offer them bariatric surgery. That is, teens after 16 years can safely undergo bariatric surgery, but then we have lot of children, the pediatric age group, that is between 5 and 15 years, where some of them are now gaining lot of weight and becoming morbidly obese at a very small age. Now because they are becoming morbidly obese, they are falling prey to diseases like diabetes, hypertension and cardiac events. So for them, with under special conditions in highly experienced center, we offer them surgeries, but they have to be only done by experienced doctors, and also here the child doesn't understand much about the surgery. So it is the parents who have to understand what is needed for to be done for the child, and how to control the child's eating habits and how to make the child active. So once the parents are counseled and they understand, the pediatric obesity surgery or childhood obesity surgery is also done for in selected cases.
So doctor, before ending this episode, is there any message you would like to give to our audience as far as obesity and bariatric surgery is concerned?
First, as a doctor, I would say prevention is better than cure. We always talk on preventive aspects because this is mostly a lifestyle disease. So cut down the portions, learn to eat small quantity of food, don't overeat the high calorie foodstuffs which we are seeing has become a habit for most of people, and maintain an active lifestyle, include exercise in your day-to-day life, and also learn to be more mobile during your working hours, be it at home or be at office. Don't become couch potato, and also include more unrefined food like vegetables, fruits and cereals in your diet. And unfortunately, in spite of this, or for some reason you have put on so much weight where now weight is becoming a big trouble to you, utilize what the science has there to offer, utilize bariatric surgery, cut down your weight, cut down your medical problems, and come back to again a active, healthy lifestyle.
So thank you, doctor. It was wonderful having you here on our program today.
Thank you.
So this brings us to the end of this episode. Hope this episode was informative on the topic bariatric surgery. And don't forget to join us for the next week as well. Until then, take care and stay healthy. Thank you.